Biceps reflex. The former should be supported either resting of the patient's thigh or resting of the forearm of the examiner. The arm is midway between flexion and extension. Place your thumb firmly over the biceps tendon with your fingers, curling around the elbow, and tap briskly. The forearm will flex at the elbow. Support the patient's forearm by cradling it with yours or by placing it on the thigh, with the arm midway between flexion and extension. Identify the triceps tendon and its insertion of the olecranon and tap just above the insertion. There is the extension of the forearm.
To activate the knee jerk, you need to strike the quadriceps tendon directly with the reflex hammer when the leg of the patient is rest and the patient is sit hanging their feet on a 19-degree angle on their knee. To activate the brachioradialis reflex, you need to strike the brachioradialis tendon directly with the hammer when the patient's arm is. You have to strike the tendon roughly 3 inches above the wrist. These nerve roots are located on the cervical part of the spinal cord, which is on the neck. Those nerve roots are born in the lumbar part of the spinal cord, which is on the lower back.
And sitting position, the examiner passively dorsiflexes the patient's foot by pushing up the patient's forefoot. The Achilles tendon is struck briskly. With the supine position, the foot is similarly dorsiflexed while rotating the leg externally to expose the Achilles tendon. Using a reflex hammer, the practitioner then strikes the Achilles. Place an index finger onto the tip of the mandible at the mental protuberance, and tap your finger briskly with a tendon hammer. Normally, this reflex is absent or very light. However, for patients with an upper motor neural lesion, the stretch